So these are the tests to do to check your kidneys. Please, I hope you know that kidney failure does not show sign until the kidney is almost gone. So if you're expecting when you start bloating, when you start swelling, when you can't urinate again, by that time it must be too late for the person. So you have to do this check your kidneys at least once in a year. But if you're hypertensive, you're taking high blood pressure medication, and you're diabetic, check your kidneys as frequent as often. Okay, so don't expect when you get so sick or when things become so bad, because if found out early, if you go and check, if you're okay, you need to go and check your kidney function test. If they found out early that something is going on in your kidneys, it can be salvaged, it can be managed. But that point where you start bloating and you start becoming, you can't urinate, you become so down, they check, the kidney is almost like 100% gone. There is no cure apart from dialysis, kidney transplant, or divine intervention from God to give you new kidneys. So let's get to it. These are the tests you will do to check your kidney function. Number 1, urinalysis. Now, urinalysis, what urinalysis does is it checks to see if there's any abnormalities in your urine. For instance, if there is protein in your urine, if there is blood in your urine, if there's glucose in your urine. Normally, protein is not supposed to be seen in your urine because the kidney can't filter protein. So once protein is able to pass through your kidneys, it shows that there's a problem, and it's better they found out early so that they can start managing you early. So you do urinalysis. In Nigeria, it's not expensive. I think it's like 2,000 or 1,500 or 3,000. I don't know. Number 2, the most important of them all is kidney function test. Now, this one is 15,000 naira. I don't know which country you're watching from. Some are free if you have a health insurance. Some are 8,000. Depends on the hospital that you go. Kidney function test checks the way your kidney functions, how it clears the urea creatinine levels, your electrolytes. If they are higher, it means, or if the numbers is coming up, it means something is wrong and it can be managed early. Another one is estimated glomerular filtration rate. Okay, this one checks your your filtrate level. Don't worry, just the 3 most important ones you should know about now is urinalysis, kidney function test, estimated glomerular filtration rate. If you do this test, send them to me. I will explain them to you on my Instagram page. Okay, I will explain them to you if you don't have a doctor, or you can take it, go to your doctor. Now, the next thing to do is to check your blood pressure. Check your blood pressure and your sugar level. Your blood pressure, you must check it every now and then, at least once in a month. But if you're now hypertensive, you should have a blood pressure machine. Blood pressure in pharmacies are free. It is free. And blood pressure is the silent killer. Look at that video I made on my YouTube on the silent killer. Blood pressure it can damage your kidneys. It can kill you. It can give you stroke. No signs. People are walking around with 230 something blood pressure. They don't know, because you will feel okay. Nothing is going to be wrong. Most people, you will feel okay. So check your blood pressure every month. If every month, if you're not hypertensive, or at least once in 3 months. Check your sugar level. Most people don't know that they are diabetic. These 2 things will destroy your kidneys. Now, save money, check your kidneys. Now, very important one. There is this investigation that people don't do. It's like kidney awareness has become almost everybody's getting aware, but this one is about the heart. People don't check their heart. This is not good at all. There is this investigation that you need to do at least once in a year to check your heart. This issue that you hear people slumping, they just slumps, they just, they don't know. Finally, they will not find out that they had a heart issue and they had no idea. Please do this test every year, at least once, to check your heart, especially if you're getting elderly. But everybody must do it. ECG, the name is ECG, electrocardiogram. This test checks the way your heart works. When you come to do it, it will be like, you will think it's a very serious test because of the instrument they will bring. No, you just they put on those electrodes, and it's not expensive. It's about maybe 12,000, 15,000 too. Okay, you go where they do it, you go to a cardiac hospital. I can recommend one for you. Okay, they test your heart, they check the electrical conduction of your heart. If there is impending danger, they will find it out through the the electrolytes, your doctor, the person doing it will give it to the doctor. They will find out, so that in case if you're developing a heart failure, heart block, anything that is about to happen, okay, these electrodes will find the impulse, okay, and they will interpret it and start treating you, start giving you drugs, okay, so that you will not, this thing we do here is just for awareness, so that you become aware of your health, okay, because of the things that we eat these days, okay, a lot of things, that we eat, it's not like in the olden days where everything was natural, they work out, there is no so much toxicity around, okay. So let me know if you have more questions. You can chat me on my Instagram page with your kidney function test, not the heart test. I'm a renal nurse, I'm not a cardiology nurse, okay. So like this video, share, so that people will understand, so that people will be aware of their health. If you have anybody that wants to do kidney transplant, that is doing dialysis, let them come to me and ask me whatever question they have. Meanwhile, go to my YouTube page, there are a lot of videos.